Started. So hello everyone, my name is Marwa Ahmad and I am a community health system specialist with San Bernardino County Superintendent of Schools. So I just wanted to say welcome everyone to our school-based health center webinar series. So in September, we were able to really discuss and dive into the definition of what a school-based health center is, an overview of the healthcare models. And today we have Sang and Amy from California School-Based Health Alliance to really provide us an overview of how to start a school-based health center on our school campus and who to involve in the planning committee, because that's super important. So I'll go ahead and let Sang and Amy introduce themselves, and then we'll jump into today's presentation. Do you want to start, Amy?
Yeah, so sorry, technical glitch right there. Thank you so much for having us. I'm such a gracious host, and we're really excited to be here. It was nice to talk to your county last month, and we're excited to be back and excited to come back a few more times and do sort of a whole spectrum of school-based health and wellness centers and what you need to know about starting them and financing them and operations, all the things. My name is Amy Ranger, and I'm the Director of Programs at the California School-Based Health Alliance. And I think, Mara, if we want to start the slide deck, we have a little sort of overview of CSHA and who we are. I have worked in school-based health centers for the last 15 plus years. And the California School-Based Health Alliance, we are a statewide nonprofit. We work closely with state government offices like the California Department of Education, the Department of Public Health, but we are an independent nonprofit that helps schools across California to start new school-based health centers and wellness centers and to maintain the ones that they already have and improve them. We do that through lots of different ways. We'll tell you some about those today. We have a really robust website, although sometimes a little hard to find things, so let us know if you can't find what you're looking for. And we do trainings like such as these. We do in-person convenings. We have an annual conference that I can tell you about. We have a lot of different tools and forms and policies and procedures. We really try to provide anything that a school might need to sort of get from the moment of, hey, we need some more health services to having a full-fledged up and running health and wellness center. So that's the California School-Based Health Alliance. You can go to the next slide. And Sang, do you want to introduce yourself as well?
Yeah. We're so happy to have this partnership with SBCSS. Sorry, it's the acronyms. And to really to look forward to the rest of the school year where we'll be able to do these bi-monthly webinar series. So my name is Sang, and I've been doing school-based healthcare work for probably about the same amount of time as Amy, for a little over 15 years. I actually got my start with the Alliance back in 2006, I think, and was there for a number of years. And then the last 10 years I actually spent working for the Los Angeles Trust for Children's Health, which actually works with school-based health centers in LAUSD, which happens to be the largest school district in the state and the second largest in the country. And so a lot of my experience and what I'll share today actually comes from those 10 years plus the prior years with the Alliance. I have a background in public health, and right now I'm working as a consultant to the Alliance, and I'm really excited to be working in the Inland Empire region. It's actually where I call home, and really just to help expand school-based health centers in the region is really exciting. We know that there's been a great need for many years, but now we're able to actually dedicate resources to that region, and also to really form partnerships like the one we have here today. So yeah, thanks, Amy.
Thanks, Amy. And yeah, just to reiterate that we as a statewide organization have specifically invested time and resources in San Bernardino County because of the need and because of the momentum. Like as a county, you all are really excited to launch more health services, and we're really excited to support you in doing that. So we are here for you. Next slide, please. We are a member-based agency, and so we do request that folks become members if you're able to. It's a pretty low cost, and it does give you a discount to our annual conference, which, next slide, is coming up in April on the 17th and the 18th in Sacramento. It is a full-day conference and then a full day of advocacy with state legislators. So that's the website. We can put it in the chat. We'd love to see you all there. We do have scholarships available. We're happy to help support folks in getting there for free if you need that. So please do come and let us know if you need support. Next slide. So today we are going to be talking about a few different things. And first, let me just frame for those of you who weren't with us last month that our definition of a school-based health center is a pretty broad one. So there's lots of different kinds of school-based health centers across California. People use lots of different names for them. People say wellness centers, well-being centers, school-linked health centers, all kinds of names. We have a pretty wide umbrella. So basically, if clinical services are being provided at a school, we consider that a school-based health center that we want to help support. So that can be behavioral health focused, medical, dental, all three, youth engagement, you know, any combination of those. So it's a wide bucket. So what we want to do is talk about how to start a school-based health center, and in particular, because that could take more than just an hour to go through that whole process. But in particular, who to involve in a planning committee. And we'll dive deeper into that, as well as some of the needs assessment processes that you might have. And then we do have an Inland Empire specific coalition that happens, and we'd like to invite you to that as well. Next slide. So let's start with the really big picture. What are some of the key steps in planning? Oh, I'm sorry, saying, do folks want to quickly do a chat? This would be really helpful for us as part of the introductions before we dive in. Can you just chat your name and what organization you're coming from, and that way we can sort of see who's in the room, and we can be doing that while I start on this first slide. We did get to hear a little bit about people's lunches. So key steps in planning, starting from the beginning, some of the parts that are the most important steps are to really think about an integrated planning process. So not just your school staff, but your school staff, your community partners, your youth is being really key and central, your families, other community members, leaders. We're going to talk much more about that in depth today, but it's really about having the most integrated process that you can have. Then bringing all those people together, discussing why a school-based health center is needed, and in particular, looking at actual data on what are the needs, what are the resources that are currently available, what are the gaps, and what's the best way to fill them, which leads to the best model. So what kind of services do you need, what kind of organizations, what kind of funding structure? That we won't go into super much today, because that's a whole nother workshop. That will probably be our next one or the one after that. Because then you'll need to figure out what is your sponsoring agency, who are your participating providers, what's your funding structure, all of which are sort of decisions that fall in from each other. And then who are your champions that are going to help you get the center started. Saying, do you want to jump in before you go to the next slide?
I think, you know, the idea of finding champions is definitely, you know, from the very beginning, you know, and we'll talk more about, you know, what that could look like. But sometimes, you know, when you're able to have like that one or two, you know, champion to really, you know, help advocate for what you want. And you know, we always say it's the message, but it's also the messenger. It could really help to expedite the process. And the other thing too is sometimes our champions are people that are not people who we think support this, you know, and kind of have to like peel back the curtain and be like, oh, wow, you know, you just have to find resonance, you know, in the people who really care about these issues. And people also just love being able to champion for things that they care about too. So even providing opportunities for that. But we'll go over this, we'll go over that slide a little bit later. Thank you, Amy.
Yeah, great. Next slide. So the key questions that your planning committee will be trying to answer as part of their process is, who will the school-based health center serve? Which you think would be straightforward, but actually is more complicated than it sounds, because most traditional school-based health centers, and I use that word intentionally because by traditional I'm talking about with primary care at their center. So sort of a traditional school-based health center has primary care primarily, and then also behavioral health and dental sometimes, and vision and optical and other things like that, but it really starts with primary care. So of those, almost all of them serve people besides just students. And that's partially about reimbursement and about patient need. Like, in order to have a full-time or almost full-time nurse practitioner, you need a wide patient base, right? Behavioral health, for, sort of in comparison, many a smaller patient base can sustain a behavioral health clinician, because a behavioral health clinician might see 30, 40, 50 students in a year, and that keeps them busy. Whereas a medical provider needs a patient base that's much broader, because the needs of those patients aren't so, regular. They don't need to come in every week typically for services the way someone does for behavioral health. So if primary care is at your center, you probably need a broader sense of who do you serve beyond just the students at your school. So that could look like the students and their siblings. It could look like students from a feeder school. Sometimes it's students and their families. Sometimes it's the whole neighborhood or community. Like there's some sort of intentionality behind how broad and narrow is your patients or your clients. Then there's the services, which then corresponds, of course, to the staffing model. Do you have medical? Do you have behavioral health? Do you have dental? We strongly encourage having an administrator or a coordinator, someone who brings together all the partners and makes sure to coordinate all the outreach and to work with the school staff. So not just the providers, but also the administrators, a health educator, someone to lead some of the youth engagement work, thinking really creatively about all the services that you want to have, and then who are the people, both from the school side as well as from community partnerships, who are the people who are going to provide those services. Facilities, obviously, the different kind of services need different facilities. You have to have plumbing if you're going to do primary care or dental services. It's really helpful to have things like a bathroom. The dental operatories are more expensive to set up. So there's all kinds of sort of facilities considerations. And we have a lot of really helpful tools to help you think about how much space do you need, what kind of space do you need, how to make it cheaper, how to take an existing space and convert it if you don't have the money to build from scratch. There's been some great creative work that's happened. People have taken mobile units and turned them into clinics. They've taken like old portables or old gymnasiums or boxing centers, all kinds of sort of abandoned space, and figured out how to make that into a health center at their school. Then funding, how are you going to get the initial funding to do that construction or do that renovation, but then also how are you going to sustain? And again, we have a lot of tools and strategies around how to bill and how to do graded funding and graded billing, so that medical providers are billing their strands, behavioral health providers, schools are pulling in money, districts are pulling in money, there's new community schools money, lots of new behavioral health money. So how to pull together all those different strands of funding to make your health center sustainable in the long term. And then what kind of tools and communications do you need to have the coordination between all those different providers and agencies? So those are the questions that you all in your planning committees, as you walk through this process, will need to be answering. And it really does vary by school, right? Some schools are small, some are big, some have a really high Medi-Cal population, some have a lower, some have existing services, some don't. Some have services they can easily pull from the community, some don't. Some serve just little kids, some older, adolescents, sexual and reproductive health. Like there's all kinds of considerations that mean that one school-based health center doesn't work, one model doesn't work for every school. And that's okay. It's about figuring out the model that works best for your community. Dang, what did I miss?
I was going to say, for the first bullet point about who will the SPHC serve, I know for some sites, they want to start with just maybe the students at that school first, and then sort of do a rollout, as they expand or as they are able to build out, and perhaps recruit more providers. Maybe it's like you said, the students at that school and their siblings, and then maybe in in another year or two, think about the feeder pattern, right? Like if you're at a high school campus, which are the middle schools in your maybe 1 mile radius that you really want to be intentional and say, we're going to invite the school nurses from those middle school who are going to feed into our high school to really be part of this, because that could be one way to really serve your surrounding community. But the middle school students will at least get to hear about the clinic on that campus, so they have something to look forward to when they get to that high school. But really it's about thinking about what your capacity is, and also planning ahead about where can we take this, because then that can definitely be part of the planning process, but maybe it's not going to be something that you're able to do right when you open. I know some sites really focused on providing the medical services first, even though they they know dental is probably the biggest need, but they wanted to at least build their patient base and then really maybe add in dental, after a couple of years when they can kind of figure out their patient, the patient base or what have you. And so I think, and the SBHC serve may evolve too, as we know communities change or, and needs change. Yeah.
Thanks, Meg. Next slide, and then I think that's you.
Yeah. So one of the things that we encourage everyone to do is to really conduct that needs assessment. And of course, there are many ways to go about doing this, in addition to, doing surveys and focus groups and having roundtable meetings and listening sessions. One of the more concrete ways is to really bring in data into the process, because we know data really helps inform decision making and really allows us to, think about this, I think from a more concrete level. And so these are some of the ways that some of the areas of, data sources that we suggest that you use, and in our later in the next slide we'll actually have the links to these sources. But one of the most common sources is the CHICS survey, which is California Healthy Kids Survey, that really helps you think about the population of your school. And then we also look at proxies for healthcare needs and also poverty levels. So free and reduced price lunch rate is one of the proxy measures that that are used to understand need. Or sometimes Title I school is related to that too. Medi-Cal uninsured rates, we know that fortunately that has gone down, the uninsured rates over the years because of ACA, but we still have lots of communities where that number is still high. And even for those who do have insurance, the next question is, what about access? What's in their community that they can access? And so really to think about that as well. County public health indicators, all of our public health agencies in California collect this community health data, and so that's really helpful to understand what the needs are. And counties collect a wide range of things, everything from asthma to chronic conditions, and exposure to violence and things like that. I want to mention that in where I worked at the LA Trust, when LA Unified School District was getting ready to build out their new round of wellness centers, it's a large school district. So of the 50 high schools that exist in the district, only a handful had a school-based health center. So they're trying to think, okay, we can't build a school-based health center at all 50 high schools, but where should we really think about putting them? Because we know that oftentimes school-based healthcare is a place-based initiative, right? Where you live, your zip code matters. And so what they did was they partnered with the local health department, and a planning committee actually went through and looked at the 7, I think, indicators that could really tell the needs of, of their students in the community. And some of those 7 were teen birth rates, asthma rates, exposure to community violence, I think it was chlamydia rate, and then free and reduced lunch. And so again, both socioeconomic indicators as well as health indicators, to really think about where are the areas of greatest needs. Now, you might not need to do that if you are already at a school where that there's a high need there, and it's not about choosing which school, but maybe thinking about what my school needs. Is it do we want to prioritize, if we have limited resources, which we all do we want to prioritize delivery of behavioral health first before we bring in primary care, or dental health or what have you? But for some of our school districts that are larger, which I know also exists here in San Bernardino, maybe that's sort of your first lens, is to think about, okay, of the 26 schools that we do have, where might we have the best bang for the buck, or at least the area of greatest need. And so I think using existing data sources is really helpful. We also want to look at attendance and dropout rates, because we know there's a lot of research on the link, right, between students being able to come to school when they're healthy and vice versa. And of course, we know that there's been some studies out there where it shows, having a school-based health center on a campus actually reduces absenteeism. You don't, have to take a whole day off to go. You're able to, we're able to help manage students with asthma because there's a clinic right on campus and what have you. And then also looking at school discipline rates, that those intertwine with, being able to offer behavioral health services, calming centers, things where students, really get the support that they need, when those issues arise. And then the last one I put in there is something that we actually created, and that's the California Student Health Index. This was done a couple of years ago in partnership with a graduate student at UC Berkeley, where we were able to look at using a wide range of data sources to look at schools with the highest needs and where people may want to consider placing a school-based health center. And so next slide, please. I think we have to click. There it goes. Yeah, sorry about that. Yeah, so this, we left this in here so that way when you get a copy of the slide deck, you'll be able to click right onto these links and kind of explore for yourself. But we're also happy to, help support this. And some of these may not be the only sources, but, they're good places to start, with, our California Department of Education and County Public Health Department and things like that. But let me spend a couple of slides talking about our Student Health Index. Next slide, please. So this, and I put the URL up there as well, so that way you can access it. We actually hosted several webinars just on the index itself. And so what I'm going to share with you is literally like a very snapshot of it. But the idea was, how do we bring in different socioeconomic, health, and school level indicators to really think about which schools are the highest needs, and then using all of that data to come up with what we call a relative need index. And so it's the index itself is hosted on Tableau. For those of you who have used Tableau, it's really fun to like walk around, move around and put in different indicators, and it's super interactive. And so this is a screenshot of what that page looks like, but it is live, and all the data is in there. Go ahead and go to the next slide. So yeah, so unfortunately we won't have time to kind of walk you through that, but that could be something you can do later on your own. But using our student health index, what we found was that we looked at the counties with the highest ratio of high need schools to all schools. So thinking about what their needs are relative to other schools around the state. And here you can see our county, San Bernardino, is in that top 5. And that's one of the reasons why, the State Alliance is really investing in this region, as well as, some of our funders who know the need is there. Next slide, please. This is just, sorry, someone's like knocking my door, but I'm just going to ignore it. The thing I want to mention here is that San Bernardino has 3 of the top 10 school districts with the highest ratio of high need schools to total schools. And I actually marked them right there. You can see there, Rialto Unified, San Bernardino City Unified, and the Hesperia Unified. And in fact, when you go onto this index, you're able to zoom in and you're able to toggle on the map to see actually which school it is. And when you're toggling it, you're able to see some of the health indicators that we have in there, just to, give you more data on what that looks like for that particular school. And so this is one of the data sources that we really encourage you to use as part of your planning process. Next slide, please. As you're thinking about your planning efforts and putting together a community, we want to really emphasize that school-based health centers are really about partnerships. I know many of you are getting the planning grants for your community schools work. And of course, that is also based on, strong pillars of partnerships. And it's the same for school-based healthcare. Schools can't do this alone. Healthcare, community health clinics who want to go and serve populations can't do this alone, right? They need partners at the school site to really, understand, the needs of students in the community, and also, be able to, add that perspective to that. And so we always say that the best school-based health centers are because there's a strong partnership between the district, the school, and the clinic provider, in this case, providers, because in many, many instances, there are more than one type of providers. And so in terms of partners, these could be community-based organizations, municipalities, county health departments, mental health providers, and really thinking about how do we offer services to students, their families, and the community when we're all able to work together and really integrate. And we won't go over it in this webinar, but we actually developed a tool in partnership with UCLA on trying to measure what integration looks like. When you say, oh, is your school-based health center, is it integrated? We can say yes or no, but what does yes really mean, right? And so we actually worked in partnership with UCLA to develop a validated tool to have you measure what does that mean and how integrated you are, because we know the more integrated you are, the more successful your operations will be, and ultimately it's also about how best to serve your students. And so it's one of the tools that is used not only for existing school-based health centers, but for new sites to really start to think about, and it will really help with your planning process. Go ahead and go to the next slide. Okay, this is a diagram that is just one example of what a relationship can look like between the school-based health center team and the school staff. And so on the left side there, you can see these are, types of roles. Amy mentioned earlier that having that administrator is really key to a lot of school-based health centers that we see that are tend to be more successful, because you just need that organizer, that administrator, that conductor, right, to make sure all the moving parts are working together, talking together, and we're not we're overlapping, but we're not tripping over each other trying to provide services. And so there could be a coordinator or a manager of that school-based health center, and then of course you've got the clinical staff or the medical and behavioral health staff, and even the sponsoring agency staff, people who help with marketing and communications and billing, particularly for community health centers that tend to be larger. And then on the school staff side, these are people many of you are from school districts are already familiar with and know that these are the people we know it takes to be able to have these kind of partnerships, are your school principal or administrators and teachers. And really the gray boxes in the middle there, those are the people who help gel things together, right? Your school nurse, your school counselor, your health assistant. And so, we can certainly share different diagrams of how people come together and what integration looks like. But this is just one example that, we really encourage people to think about. Next slide, please. I love this. This is Alameda County School-Based Healthcare Agency. I think that's the name. Yeah, the county level. They have been doing school-based healthcare for many years, and they put together a really great toolkit. And this is actually the cover of their toolkit. And this just depicts all the different things that school-based health centers can provide. Amy mentioned earlier, what kinds of services will really help depend on what kind of model. And in this case, you can see it's probably a pretty well integrated model if you're able to provide everything from medical to dental to behavioral health, but also things that happen outside the clinic walls, right? Which we know really helps determine health outcomes, which are health education, youth development. Some of the best school-based health centers that we've been able to visit over the years, Balboa School Clinic in San Francisco, some of the ones in Los Angeles have really invested in youth development. And we find that those are the ones that actually help to make their school-based health center successful, because what happens is you're putting young people at the heart of your work, because that's ultimately who we're serving. But I just love this picture and wanted to share that here. Next slide, please. I thought I would just mention this because before we dive into the conversation of who should be involved, Meg Wheatley is a writer and I think a organizational strategist, but this is her quote: "The world doesn't change one person at a time. It changes as networks of relationships form among people who discover they share a common cause and vision of what is possible. It is critical connections, not critical mass." Although I would just say, you know, our movement, we also like to see critical mass, right? We like to really see this become a model of what you do at schools, which is providing, you know, support services like medical and other behavioral health services. But yeah, I just thought it was a really nice quote to think about, that it really is about the relationships that we form in order to collaborate and work together to provide, you know, what I think our young people and their families deserve. Next slide, please. Okay, so we're going to spend a little bit of time on here, and I'll try to I'm also watching time because we do want to have a short breakout session for you all to be able to talk about this one particular slide. But when we think about having you all form your planning committees, or maybe you already have a planning committee, but you you might want to revisit to see, you know, who else is not at the table or needs to be at the table. We came up with, you know, categories of people, starting with school administrators. They absolutely have to be involved, right? You want decision makers at the table who can, who are responsible for budget and staffing and things like that. And also it, you know, just, you know, it helps to bring in that perspective, right? You know, from a high level administrator. School board, you know, for smaller districts, maybe you don't have a full-time school board. Maybe you do. In LA Unified, because it's such a large district, you know, we had 7 school board members, and they actually have full offices, and each office was staffed with a chief of staff. That's how you know how big the district is, when they have chiefs of staff for each school board member. And oftentimes we would think about who on their offices can really support the planning process. You know, it might not actually be the school board member themselves, but maybe one of their staffers. Maybe, you know, their liaison to communities or liaison to parents might be somebody that you might want to invite. And oftentimes you'd be amazed that school board offices really appreciate getting involved, because, you know, they want to make sure that they're doing, you know, they're making programs and policies that benefit their constituents. And so that's, you know, definitely an area we want to make sure to include. School staff, that's pretty obvious. It could be a health teacher, it could be a counselor, school nurse, you know, a school staff who really understands and is committed to providing more than just educational services, but really support services to students. Community leaders, this could be from, you know, again, thinking about not only elected officials who may not have the time, but, you know, who are more of the natural community leaders, you know, pastors, what have you, just thinking about how to get them involved, because ultimately, you know, the reputation of your school and your clinic is oftentimes dependent upon the perspective of, you know, communities in the area. Parents and caregivers and families. At LA Unified, they did a wonderful job of bringing parents, because almost every school had a parent center, and parents love being involved and being invited. And I know even some of the planning committees made sure to have Spanish interpreters, because we had a large Spanish speaking population, you know, so that way they can actually participate in meetings. And so really thinking about involving parents is a wonderful way. And not only that, right, we know schools in general always want to get parents involved anyway, and we see fewer of that, or a lower level of involvement, you know, as you get older. Healthcare professionals, you know, it doesn't have to necessarily be a clinician. It could be, you know, a fund development person from a community clinic, you know, or, you know, public health folks. Youth, this one is probably one that is sometimes overlooked, even though that tends to be the population that we're serving. We've had planning committees where they would invite you know, associated student leaders to be involved, or, you know, recruit from a health class. We've also had classes where, you know, they would actually help with the planning process. Maybe they could take on conducting a survey among all their peers about how would you like to see your school-based health center design look like, you know, or what have you. And so really involving students, involving youth. One site in northern part of LA County actually had their youth members pick out the colors of, the colors, plural, of the waiting room and how to decorate it. You know, they wanted to make sure that it really represented what young people wanted. And so really excellent ways to be able to bring youth involved and really have them be part of that voice. I mentioned earlier public health professionals, community-based providers. I think, this is especially important because, like Amy said, depending on your delivery of service model, maybe you want somebody who can help families enroll in Medi-Cal or CalFresh from a local community agency or what have you. And so really think about the people who you want to potentially partner with, but also people who understand what's already being delivered in the community, right? So we can understand where the gaps are. Other community groups, and then local foundations and other funders. That's really important, right? And sometimes we overlook that. We know that, hospitals have community planning process and they do this every few years. We know lots of foundations really want to give. And this is one way to get them involved is to say, what, there are great needs here, but, help us think through how to make this happen. Okay, so I went over quite a bit. And of course, a lot of this is not only thinking it through, but also thinking of ways in which they can be involved. During in the committee itself, such as who can really help facilitate these conversations. What we want to do now, and we probably don't have as much time, is if you have your phones, go ahead and take a screenshot of this slide. Because we would like to break you out into small groups so you can start to, first of all, meet each other, but also think about, what names come to mind that you might want to invite. If you already have a committee, great, check off, which of these that you already have and who's missing. Or maybe it might be a little imbalance and you want to balance out the committee a little bit. So go ahead and do a screenshot of this. And then I think, Karen, I don't know if you're ready to have people go into breakout rooms.